Hello my dear friends, I'm Dr. Vaishali Bharambe, Professor Anatomy. And I have a question for you. So why do you put a trocar for pleural drainage along the upper border of lower rib and not along the lower border of upper rib? Why not here? Why here? What are you trying to protect? Good question. The contents that you are trying to protect is what we are going to talk about today. The intercostal space, it's containing nerves and blood vessels. So let's enumerate the contents of intercostal space. The muscles, intercostal nerve, artery and vein. The muscles have been covered in the earlier lecture. Now it's about intercostal nerve, artery and vein today. This video requires you to draw. So do please sit with drawing color pencils and maybe a nice notebook or maybe your iPad. Okay, but do draw with me. You will be surprised at how much of the class you carry away with you. Sometimes drawing is the only way you can learn. Use it. Right. Let's talk about the intercostal nerve. Let's define it. What do I always tell you? Define something to bring yourself into the game. Intercostal nerves are ventral rami of thoracic nerves. Okay, great. All these are ventral rami. They run in intercostal spaces. They supply the thoracic wall. They're all intercostal spaces. Right. How many pairs of intercostal nerves are there present in the human body? There are 11 pairs of intercostal nerves for the 11 intercostal spaces from T1 to T11. T12 actually supplies abdominal wall and therefore we do not call it an intercostal nerve. We call it a subcostal nerve. An intercostal nerve, please build a mind image, requesting you. Keep on, maybe you can even close your eyes. Build a mind image. An intercostal nerve is ventral rami of thoracic nerves. Yes, T1 to T11. Runs in intercostal space. Imagine it's running in the space between internal intercostal, intercostalis intimi. Supplies the intercostal muscles as it's traveling. Supplying the skin over the thoracic wall. Later on, it even goes into the abdomen and supplies the abdominal wall as well. All these are intercostal nerves. Now the question arises, what are the types of intercostal nerves? There are atypical and there are typical. Typical are the ones that run in a typical intercostal space. Which were the typical intercostal space? 3rd, 4th, 5th, 6th. 3rd, 4th, 5th, 6th. Therefore, those are the typical intercostal nerves as well. So, let's talk about a typical intercostal nerve, not atypical. It's a typical intercostal nerve. Okay, right. Formed by ventral ramus of thoracic nerve. This is a beautiful diagram. You're going to develop it later. This is just to show you. And on this diagram, actually you see a lot of material. Come, I'm going to show it to you and then we're going to draw. So here's your spinal cord. You can see the dorsal root ganglion. You can see the nerve emerging out of the intervertebral foramen. You can see it giving rise to a dorsal ramus. Here's the ventral ramus, which is actually the intercostal nerve. Observe how it is communicating with the sympathetic chain here. Okay. White ramus and grey ramus. Okay. Communicating nerves. Then it travels along the thoracic cage in the costal groove, VAN. Vein, artery, nerve. Nerve is the lowermost structure in the costal groove. As it's traveling along the thoracic cage, it gives rise to a collateral branch. While the structures in the costal groove are high up, the collateral branch runs along the upper border of the lower rib. Okay, so it's a little more at a lower level. Finally, the nerve gives rise to a lateral branch that you can see dividing into posterior and anterior branches. Then it pierces the muscles of the anterior chest wall and forms the anterior cutaneous branch, which supplies the chest wall again. The cutaneous supply to the anterior part of the chest wall. So lateral branch, collateral branch, anterior cutaneous branch, all these are supplying cutaneous supply as well as muscular supply to the chest wall. So what were the branches? Communication with sympathetic ganglion, white and grey rami communicans. Muscular branches, collateral branch, lateral cutaneous, anterior cutaneous branch. Easy? It is actually very easy. So my suggestion is draw typical intercostal nerve with me and you will be surprised at how easy it is to remember all this. It's only when somebody talks that it feels difficult. It's actually not at all difficult. Come, let's draw. Come. To draw the intercostal nerve, the first thing we have to do is to draw the thoracic vertebra over here, the heart-shaped thoracic vertebra, the vertebral canal, the transverse process and the spinous process. There's your vertebra. In the front, you're going to draw the sternum. Easy? Now, take a thick pen and let's draw the muscles of the wall of thorax. Okay? The first muscle I'm going to draw is the external intercostal. I will stop it here since later on it becomes anteriorly, it becomes membranous. Okay? Inside this now, I'm going to draw the internal intercostal, which you can see reaches the sternum. And further inside, I'm going to draw the third layer, which is subcostalis, intercostalis intimi, and the sternocostalis muscle. Okay. Now let's take a thin pen because like I told you, there are membranes to be drawn. So the pen should be thin. And now here is your anterior intercostal membrane. Here is your posterior intercostal membrane. And let's just join these up since they are considered as a single muscle. And there you have your walls of the thorax. Now let's spend a minute focusing our attention completely on the intercostal nerve, which is what we started out with. So here is your spinal cord. Just a little bit to give you an idea. Emerging from it is the anterior root and the posterior root, and here is the dorsal root ganglion. As it emerges out, it gives rise to a dorsal branch which spreads out in this manner. The rest of it continues in the intermuscular space here as the ventral ramus, and which is going to form your intercostal nerve. Before that, it gives a white ramus and then a grey ramus, through which it is connected to the sympathetic ganglion. Rest of the nerve continues forwards in the space between internal intercostal and intercostalis intimi, piercing the musculature to emerge out as the lateral branch. Parallelly, it's also giving rise to a collateral branch. The rest of the nerve now continues further till it reaches anteriorly, piercing the muscle here to divide into a medial branch and a laterally directed branch. So this is the diagram of a typical intercostal nerve, which you can see is giving connections to the sympathetic ganglion, a collateral branch, a lateral branch, and finally an anterior branch. Okay. Just to complete the image here, I'm going to tell you that let us draw the parietal pleura here, which is lining the lungs. And outside that, just slightly distally, we're going to add the endothoracic fascia. So here is your endothoracic fascia. Then your diagram of your intercostal nerve is quite complete. All I would do now is spend a minute trying to color my vertebra and the sternum. And just because I'm a bit of a finicky person, so I would like to add a little finish to the vertebra and of course also to the sternum. There your diagram is complete. So that was a wonderful drawing of typical intercostal nerve. Let's ask ourselves a question. Why are the others atypical? What is wrong with them? First is atypical because it actually participates largely in the brachial plexus. Second is atypical because it gives rise to its lateral branch, which becomes intercostobrachial. 7 to 11th are atypical because they actually supply the anterior abdominal wall as well. They are not limited to the thoracic cage. Got it? So that's why they're all atypical. Let's talk a little bit about applied importance. Have you ever heard of somebody saying that I have a huge rash along my chest wall from posterior to anterior? Have you heard of it? Yeah. In Marathi, we call it nagin. So it's like patients used to believe that it's like a snake going around their chest wall. This was infection of the nerve called as herpes zoster. It's quite painful, distressingly painful for the patient. This same painful condition can happen in case of rib fractures as well, quite painful. Okay. So what do you see in herpes zoster? You see painful fluid-filled skin eruptions, okay, vesicular. And these eruptions appear along the dermatome of that nerve. So, along that nerve, you will see the eruptions, and that's why people used to think of a snake because it used to wind around the patient's chest wall. Okay. If you're enjoying this lecture, do please like, share, and subscribe to my channel and hit that bell icon. Dear friends, do visit my website vbanatomy.com. On this website, you will find a lot of anatomy videos of optimum quality, just as required for a student of anatomy. There are also some surgical anatomy videos for senior students. There are osteology videos, histology drawing label videos, MCQs, and much more. My website attempts to make you an optimum learner of anatomy. Come visit, learn. Link is in the description section. Let's move on to the intercostal arteries now. You must be thinking, shouldn't it be the same as intercostal nerve? It should be, but it is not. So you'll have to learn separately. Come. Intercostal arteries per space are anterior intercostal arteries, 2 per space. Posterior intercostal artery, 1 per space. Let's focus our attention on the anterior intercostal arteries. There are only 9 pairs. Okay, so they are present only in the 9 intercostal spaces. 10th and 11th, they are not there. Okay, so 2 per space, none in 10th, 11th space. Anastomosis of anterior and posterior intercostal arteries takes place at the junction of anterior 1/3 and posterior 2/3 of the intercostal space. All anterior intercostal spaces are branches of internal thoracic artery or musculophrenic artery, which is a branch of internal thoracic artery. Okay. Let's understand internal thoracic artery to make this job a lot easier. Remember, this is the right subclavian and this is the right common carotid. That's the right subclavian. You can see the right subclavian giving rise to internal thoracic, which is now descending downwards just behind your anterior rib cage. You can see it descending here. It's crossed by the phrenic nerve, by the way. In the lower part, okay, at the level of around 7th rib, it divides into musculophrenic and superior epigastric terminal branches. Okay, so for 6 spaces, it is just lying behind the intercostal spaces, and below that it divides into musculophrenic and superior epigastric. In this course, it gives rise to 2 intercostal arteries per space. You can see them, one above, one below. It also gives rise to perforating branches which perforate the chest wall and supply the skin above, some of which become enlarged, the 2nd, 3rd and 4th, which will become enlarged to supply the mammary gland. So the terminal branches are musculophrenic and superior epigastric, 6 pairs of anterior intercostal arteries, 5 perforating arteries. It also gives rise to branches which are not seen in the image, like pericardiacophrenic, muscular, pericardial, and the sternal branches. So this is your internal thoracic artery. My suggestion is draw it with me to understand it well. It's a very simple diagram and it's going to stay with you for good. So please attempt to draw it with me. All anterior intercostal arteries are branches of internal thoracic or musculophrenic. So let's draw this. Let's first draw the sternum here. This is for the second rib, the third rib, the fourth rib, the fifth rib, the sixth, seventh, and this is a xiphoid process. These are the two joints. Okay. Now, let's quickly color them. Sternum, colored. Okay. Now, let's take a light blue colored pencil. Why? Because most of what we are drawing is basically costal cartilage. That's why we are taking a light blue pencil. Okay. So, here is your first rib, your second rib, third, fourth, fifth, sixth, seventh, eighth, ninth, and 10th. Okay, so that's your rib cage. Okay, now let's begin to add the blood vessels. This is a very simple diagram. Okay, now just understand that emerging out from your brachiocephalic trunk will be your right common carotid and your right subclavian, correct? Now your right subclavian gives rise to the internal thoracic artery, which begins to run behind first, second, third, fourth, fifth, sixth spaces. Beyond this, it divides into an artery called musculophrenic and a smaller artery called superior epigastric. So, musculophrenic and superior epigastric. And what it's now also doing is in each space it's giving rise to two anterior intercostal branches. 1, 2. In every space it's giving rise to two anterior intercostal arteries. This is true till the 6th intercostal space, beyond which who is giving the anterior intercostal arteries? Now they are given by the musculophrenic, as you can see. The internal thoracic is also giving rise to perforating branches. You can see 1, 2, 3, 4, okay, 5. So many perforating branches. Remember that in its journey, the upper part of the internal thoracic is crossed by your phrenic nerve. Okay, so draw that as well, and there you have a very simple diagram of your internal thoracic artery. Having drawn the internal thoracic artery, let's discuss a little bit of applied anatomy. Internal thoracic artery is often an artery of choice for anastomosing with the coronary artery in case of coronary obstruction. A surgeon's choice also for grafting instead of saphenous vein. Also used in construction of flap after mastectomy. So these are uses of internal thoracic artery surgically. Let's talk about posterior intercostal arteries. We're almost there, students. Pause, drink some coffee, maybe drink some water, and let's move on to the posterior intercostal arteries. There is some very nice clinical stuff coming up, so hang in there. Let me have my sip of coffee. So, posterior intercostal arteries. They are 11 in number. Why 11? There were only 9 anteriorly. Okay, because posterior intercostal arteries are present in the 10th and 11th space, whereas anterior are not there, right? One per space present in 10th and 11th space as well. So this is a very simple, pretty diagram. I love it because it's so easy. Okay, so let's focus now. Here's your subclavian artery. Here's your costocervical trunk, branch of subclavian. Here's your superior intercostal artery, branch of costocervical trunk. Now if you can see, the superior intercostal artery gives rise to the, and here's the descending aorta. Okay, here's the descending aorta. Now you will see that the first and second intercostal arteries are branches of superior intercostal artery. All the others are branches of descending aorta. So posterior intercostal arteries from 3rd to 11th are branches of descending aorta. First and second are branches of superior intercostal artery, branch of costocervical trunk, branch of subclavian. Please remember this. Okay, I know sometimes it becomes a little difficult to remember all this, but maybe you can work at getting a kick out of remembering it. Then maybe you will remember. Try it. So, I've taken a section through the thorax, mid-thorax, and here you are seeing the abdominal aorta giving rise to right and left posterior intercostal arteries. You can see this is the right posterior intercostal artery. You can see it giving rise to a dorsal branch which will also give a spinal branch to the spinal cord. Rest of the artery gives rise to a collateral branch and then continues as forwards. It then gives rise to a lateral branch and finally meets with the anterior intercostal arteries in the anastomosis. Like I said, junction of anterior 1/3 and posterior 2/3 of the intercostal space. If you look at the image, can you tell me which is longer, right intercostal or left? Of course the right one, because aorta is situated a little bit to the left side, so right has to cross the vertebra to distribute on the right side, so it's longer. It's related to the thoracic duct, azygos vein, sympathetic ganglion and esophagus anteriorly. These are all the branches. This is a note, you can read it on your own. But there's something very interesting, I promised you. Here you are seeing a normal arch of aorta and here you are seeing an arch of aorta showing what is called as aortic coarctation. Aorta is compressed somewhere. It's not all that rare, okay? So it does happen that your arch of aorta at one point becomes very narrowed. Now you just imagine that lower half of your body is getting blood supply through the descending aorta, but now there is a compression in the middle of aorta. How is the rest of the body going to receive blood? Understand the question first. How is the rest of the body going to receive blood? So now what does the human body do? Fantastic, very resilient, comes up with solutions every time. Okay. So what happens? How does a collateral circulation develop so that lower body receives blood supply beyond the obstruction? Now we know that the arch is getting supply. Therefore, it gives blood supply to the two subclavians, correct? The subclavian arteries give rise to internal thoracic artery, correct? Internal thoracic gives rise to anterior intercostal arteries, correct? Anterior intercostal arteries travel around your thoracic chest and begin to anastomose with posterior intercostal arteries. So blood now from that subclavian has reached posterior intercostal. Through the posterior intercostal, the blood travels back, enters into descending aorta, and through that descending aorta, it supplies the lower half of the body. Isn't it amazing? The narrowness has been overcome through this collateral channel. Only problem is that anterior and posterior intercostal arteries were really not meant to carry blood at this pressure. So, the size of the arteries becomes slightly larger and very tortuous. Okay, this causes the ribs to become notched ribs. This is clearly visible in X-rays. Okay, do please go online and look for these X-rays. There are plenty of them online. Okay, and this is called as rib notching, which is typically seen in coarctation of aorta. This is the last part of the class. You should be happy. Intercostal veins. There are two intercostal veins. There is one intercostal vein posteriorly. Two anteriorly. Just like there were two arteries, there are two veins. Easy and happy moment is that the two intercostal veins drain into internal thoracic vein or into musculophrenic vein, just parallel to the arterial network that you have seen. Don't stress about it. But the posterior intercostal veins are very important. Not that anterior not, but posterior you need to understand separately. For that, I would like to introduce to you a lot of veins in the body. Come, take a look, focus, come on. This is the right brachiocephalic vein, the left brachiocephalic vein. The accessory azygos vein, hemiazygos vein, azygos vein. Okay, this is all the venous network of our body. Now, first posterior intercostal veins, first, highest. Okay, they drain into the brachiocephalic veins, as you can see. They drain directly into the brachiocephalic veins. The second, third, fourth intercostal veins result in formation of a superior intercostal vein, which on the right drains into azygos and on the left drains into left brachiocephalic vein. This is all seen. I am just reading what is there on the screen. You can cut off the volume and keep on reading yourself. Fifth onwards, posterior intercostal vein on the right drain into azygos vein. On the left side, situation is a little different. 5th to 8th drain into accessory azygos. 9th to 11th drain into hemiazygos veins, which in turn cross midline and drain into azygos veins, which drains into superior vena cava. Okay. Now, this is a basic network of veins that you must remember. You must know. Okay. More than that, let me take you to some very important applied anatomy now. Okay. So, for that, I want you to just think for a minute. Okay. How is your portal vein formed? You must be thinking, why are we talking about portal vein? That is abdomen. We are discussing thorax. It's amazing that they're all interrelated. And that is the fun and the beauty of it. Come. Draining blood from your gut, from your spleen, pancreas, gallbladder. Blood goes into your portal vein. The portal vein now drains this blood into the liver, and from the liver it goes into your inferior vena cava and finally into your systemic circulation. This is what happens in your body every day. This is a concept map of portal vein. But one day what happens? The liver becomes cirrhosed. Liver says, no entry into me now. I am too hard to allow all this. So now the blood is not able to flow through the liver. It begins to produce back pressure. This is called portal hypertension. Blood is not able to flow through the liver. How will it reach the heart? So blood comes up with a fantastic idea. It begins to go through various channels bypassing the liver to finally reach into the systemic circulation. May it be inferior vena cava, may it be superior vena cava. And this is called as portocaval anastomosis. Cava, caval. Portocaval anastomosis. Got it? What has this got to do with azygos venous system, posterior intercostal veins? Come, let's understand last part. This is a beautiful network of veins of our body. Understand that this is where there is portal hypertension, back pressure of blood in the inferior mesenteric veins. What happens is, through this, the blood tries to make its way back to the heart through the rectal veins, through the inferior vena cava, back, bypassing the liver. Some of it goes through the abdominal wall, through inferior and superior epigastric veins, or through the back to superior vena cava, through internal thoracic and lateral thoracic veins. So blood through abdominal wall has reached up into your axillary vein, making its way back into the heart. So blood is making its way back to the heart, correct? But important thing is that some of it drains into lumbar veins posteriorly, using the azygos and hemiazygos systems to drain blood back upwards and back into the heart. Okay, so this is how your posterior intercostal veins are part of the portocaval anastomosis. Okay, helping to drain blood from even the abdominal wall. Okay, when the liver prevents flow of blood directly upwards to the heart. So in portal hypertension, posterior intercostal veins help carry blood from the portal system through azygos venous system, allowing blood to reach heart bypassing the liver. This is a very important statement. You must understand this to be able to truly understand what is portocable anastomosis. So students, I hope you liked this lecture. If you did, then like, share and subscribe to my channel and hit that bell icon. Do visit my website vbanatomy.com for detailed lectures of optimum anatomy education. Downloadable notes, test yourself on the MCQs. Link is in the description section. Do watch Thoracic Wall Part 1, where we've discussed a typical intercostal space along with related muscles, external, internal and intercostalis intimae. Link for this video is also given in the description section. Thank you students. I'll see you in my next video. Bye.